we have done a number of engagement sessions. We started with sort of our internal groups. So we've talked to the board and our medical staff. We've talked to all of our managers, and then we had a selection of about 50 staff who chose to come and help us mold the strategic plan for us for the future. Then we moved into more of an external kind of environment. And we like to talk about our 5 partners in planning. And those 5 partners are policymakers, healthcare providers, managers in the healthcare environment, the community itself, and academics. And we brought all of those people together, including some of the folks who had been in our internal sessions, and really had some great discussion about where we're heading.
There's such a huge group in the room and so many perspectives, and we all can learn from each other.
It is nice to get a group of individuals together for a day, because inside I see not only are there healthcare providers and administrators, there's also community members, which is great, and there's also people from the region.
When you've been looking at the problem for so long, sometimes a fresh perspective or somebody with really little insight into the actual problem have some of the best ideas.
We have to work with each other, find common areas of concern, and work together, and with that we'll find some more efficiencies.
The strategic directions are really derived from what we're living and breathing within Northwestern Ontario. So we started looking at the health status of the population that we serve, and looking at the demographics, looking at some of the things that are particular to both the health conditions here and some of the other things that we can actually make a difference in. And then from there what we did is really rounded that out with the engagement sessions, so helping us to understand what those things meant to people and what was important to them.
I like the discussion that's happening around my table, and I particularly like the way the discussion is being facilitated with the thought given to the community partners.
So instead of saying, okay, here we are, we're starting from scratch, no, let's go out there, find out how other people are doing things, look at the success stories, what works, what doesn't work.
We believe so strongly in engagement that the process was not only speaking with people up front and helping us to design the strategic directions. We're now going back to that full group, and it's going to be an exciting day on June the 6th when everybody's in the room together, and we're talking about what we've done with all of the information that we heard. We're going to be coming back and saying, here's what we heard from you, here's what we've been able to do with that, and then also trying to help us shape the next step in terms of developing the action plans. In 2015, we will be healthy together, and it will be dramatically, I think, a difference in terms of how we're delivering care, both within Thunder Bay Regional, and also how we're working with our various partners to ensure that as a community, we're healthy together.